Good afternoon. This discussion is covering information that you will find in Chapter 57, which is Female Reproductive Disorders. And we're primarily going to focus this discussion. I'm going to try and guide you through this chapter. And we're going to look at typical vaginal infections that may not be related to sexual intercourse. We will also explore at the end of the discussion sexually transmitted infections and signs and symptoms, complications, and management. We also will talk about a few of the female disorders related to structures and also a few of the very specific female cancers. So different than the last few chapters, these are very specific to the female and would not be covered elsewhere in this course. So let us get right into our discussion and talk about vaginal infections first. So the vaginal infections that we're going to talk about here are infections that can happen that may have nothing to do with intercourse. These are things that can have commonly like irritants, wet clothing, tight clothing, things that disrupt normal flora of the vagina. As you learned many lectures ago, there is a balance of flora in the vagina, and we talked a little bit about this when we talked about the presence of group B strep in the vagina and the risk that it carries to the neonate. Well, much like the non-pregnant woman, when we're talking about these vaginal infections, when we have something that disrupts the normal flora or irritates the normal flora, we can then females will develop a vaginal infection that's really inherent to balance within the vagina. So normal vaginal secretions typically have a pH of about 4 to 5. They are considered to be non-irritating and non-offensive in odor, and they often are clear to cloudy, and that's normal. So you have to understand normal before we get to the three most common types, and that would be your candidiasis, which is also known as a yeast infection, and its classic symptoms are an itch and cottage cheese-like discharge. So it becomes thicker, becomes more white, and women typically are very aware of this happening. Before I move on to bacterial vaginosis, candidiasis is often seen clinically in the presence of elevated sugars, because that will disrupt flora in the vagina. So we see it oftentimes in our diabetic population, the formation of yeast. And we also can see it in women who are undergoing any kind of antibiotic or antibacterial therapies, which disrupt the check and balance of the flora, so then the yeast proliferate, the candida proliferates. So that could be some of the predisposing conditions before a woman develops this. Bacteria vaginosis, which is the most common vaginal infection, is classically identified by having a strong, it's a fishy odor coming from the vagina, and the woman would typically note increase in her discharge. Bacterial vaginosis, when it is found, if the woman is pregnant, it is highly associated with preterm labor and preterm birth. So it is something that we need to be aware of. Bacterial vaginosis is considered fungal, and therefore it would be managed by some sort of an antifungal. There are a number of different methods of managing BV or bacterial vaginosis, but the antifungal is the most common approach that we see, typically topical, although if it's bad, some physicians will use an oral antifungal as well. And then the third one is trichomonas, or trick. And trick is an interesting infection because it can be self-induced, meaning it doesn't necessarily have to happen because of sex, but it also can be sexually transmitted. So it falls into the STI category as well. I've put it here because it is still about women who develop this. It doesn't necessarily mean that she contracted it from a partner versus that it was some sort of an irritant to the vagina. And the classic sign to that is a gray to green discharge. So it's definitely changed in color, and that's how women will oftentimes know this. Keep in mind that these three vaginal infections. It's not unusual that women actually could have it and not even be aware of it. And then she can actually restore homeostasis with her normal flora and may never have known that she was subject to it. And then I listed those common causes, and we've already talked about anything that's considered an irritant or disrupts the flora. And then, so prevention of these, as nurses, how do we teach women to prevent it? Obviously, proper hygiene, avoiding before and after intercourse, avoiding douching. Politically not correct to douche anymore. The use of condoms will always protect, especially in that trick case where the woman could catch trick from a sexual partner. And then of course, when we talked about that candidiasis, the decrease in the dietary sugars, if a woman does develop candidiasis then or a yeast infection, she's encouraged to eat yogurt that has live cultures lactobacillus in them, and that can sometimes restore homeostasis. So the next thing we're going to talk about, since we're moving away from just the straight vaginal infections, is moving to STIs, which are sexually transmitted infections. So these trick does fall into this category as well, so it falls into both, and I didn't cover it again. I didn't want to be redundant, but I've put the ones that we haven't discussed yet on this graph. And looking at all of these infections, these are all primarily contracted through sexual intercourse between two individuals. So chlamydia, and I've kind of made little notes under each name if I thought you should be aware of reportable or non-reportable. Some are reportable, some are not. Chlamydia is one of those ones that is reportable to CDC, and it typically is asymptomatic. Many women do not know that they have chlamydia. The signs and symptoms that she may or may not have would be an increase in vaginal discharge, maybe perhaps some abnormal bleeding, perhaps some change in her voiding patterns or painful voiding. She may develop a fever and some nausea, vomiting, and abdominal pain. 50% or more will not experience any symptoms and might not even know that they have chlamydia. So the complications with chlamydia is, number one, it's a transmittable disease to not only partners but also to, if she's pregnant, her neonate. So that is why we treat infants in the delivery room within 1 hour with the prophylactic dose of the erythromycin optic neonatal treatment in the delivery room. The other complications is if she has untreated chlamydia long term, it could contribute to the development of pelvic inflammatory disease, or PID, which could then render her infertile, or she could have some fertility issues. So our treatment for mom, or not even mom, any woman, doesn't have to be pregnant, if she's found to have chlamydia, will be a dose or a course of oral antibiotics. Today, in the clinical setting, the choice would be usually either a very large dose of azithromycin or doxycycline, a 7 to 10 take course of that. The HSV, which is your herpes simplex virus type 2, that's what we're talking about here, that's your STI, not type 1. Type 1 would be your cold sores, fever blisters, those types of things. But HSV2, again, usually asymptomatic until someone's realized that they have a lesion. So the woman says, oh, what is this? It is not reportable. Lots of folks are always surprised by that. We do not report herpes simplex virus, only because chlamydia is constantly transmittable, but the HSV outbreak usually lasts 7 to 21 days, and it's contagious in the active period. So it's not, it's kind of like hit or miss. And the CDC has just, they're not tracking it. They're just not tracking it. So symptoms would be your painful blisters. On the first eruption, if a woman knows she's having an eruption, she may have some flu-like symptoms, lethargy, muscle aches, a low-grade fever. But not all women know and identify and make that connection. Subsequent breakouts are usually just minus the flu-like symptoms. She'll notice that she has these blister-like lesions that break open and take about 3 weeks to heal. Most often found on her labia. Complications from herpes. First of all, there's no cure. Once you have herpes, you own it. And We're having a technical difficulty. I will come back.